In this diagram, we're going to talk about treatment. The most exciting part of our treatment is, firstly, it's natural. It's safe. It's safer than a vitamin. We call them remedies because they fix a situation. They don't just cover it up like a Band-Aid. I think the public is really getting sick and tired of using a Band-Aid approach when we need a more sophisticated treatment. That treatment is actually 200 years old, but they didn't know exactly what they were doing. Now with science and technology, we know that something called nanopharmacology, which means using very minute substances to communicate with your brain and nervous system, and that can occur after an illness, after a divorce, after a financial loss. It can also occur from long ago, from childhood, things that never got resolved. The way to get rid of them is through what's called realization. Realization. In our clinics, you sit with a practitioner, and often myself, or a trained medical doctor, or physician assistant, or nurse practitioner. And what they do is they begin to say, tell me in your life everything that's happened to you that has been difficult and it's hard for you to talk about. Those things are often the thing that's causing your stomach problem, or it's causing your infertility, or causing your chronic back pain, or your migraines, or causing you to do the wrong things for yourself, like eat improperly. If we come up to a part of the brain and we make it understand itself more deeply, that can be magical. Why am I upset? Sometimes you can see an upset look on someone's face, but they try their hardest not to let that out. Spending a whole day, what's called filtering up, pretending not to feel something when you feel it, like something uncomfortable with a coworker, something uncomfortable with your boss, something uncomfortable with your spouse perhaps. That gets stuck in this part of the brain. That's the part of the brain where we hold these things inside. Just talking about it is very helpful, but it's only helpful between 30 and 90 days. After the 30 to 90 days, when we're not paying much attention to it anymore, the problem begins to come back. And it starts to come back by plaguing our bodies physically and shutting off normal function, or by coming into our brain and shutting off healthy emotional function. The only way to get to them is by mimicking them. It's a like cures like tendency. In like cures like, we're sending up a signal that says, is this what it feels like inside holding that negative information? And is this what it feels like when you are doing the holding? There's one filter in this part of the brain, another filter in this part of the brain. So often we find people complaining of pains right here at the base of their neck and tension headaches that occur right here. That's because you're working extra hard to hold that wrong, distorted information inside the brain all day long. And people take ibuprofen at the end of the day, maybe a drink of alcohol. This is when they crave sugar, because all day long they have been struggling to not let out this negative feeling that they're having inside, and when it finally comes the end of the day, they're exhausted. That's called the filter. And we'll talk about in another diagram the tightness of that filter going into tightness in the body, and that is also the cause of a lot of arthritis, stomach problems. It's called contraction or tightness. So we free this up. We give you a medicine that comes to the center of your brain and starts to say, okay, open this up. Until you open up both of these filters, which should naturally open after 8 p.m. at night and all through our sleep, if you do not open these filters up, then the state never changes. You wake up feeling the same as yesterday. The way to open them up is by sending something that reduces the amount of pressure that that filter has on it, and that is what is called a distortion signal. And we have multiple examples of that on our website. The signal can be stuck in a feeling of anger, stuck in a feeling of betrayal, disappointment, grief or sadness, anxiety and panic, or hypersensitivity. The filter can also go through a state of thinning out, and if it thins out too much, you start feeling too much from your brain, too much from your outer environment, and you start to feel anxiety and tension too much in your body, and that can cause that tightness effect. If you're losing the ability to not feel things, you're trying not to feel things, but you're feeling them too much, and that would be a thin filtered state. So the good news is we do have a cure for this state. You've heard all the negative things that it's doing about you, and there is a cure. There's actually been a cure for 200 years, but we've polished it up. We are ready to bring it to the public to treat ailments that we thought you had no answer for. Even if you get diagnosed at one of the top institutions around in the United States or anywhere in the world, if you feel you've not had an answer that changes your disease state, we often do have an answer. And again, it doesn't have to be a strong drug with side effects. It can be a very gentle remedy that changes the way you feel. Sometimes we also use neurochemical substances that ease things like high cortisol or low serotonin or high dopamine or high norepinephrine, which makes tension. All those long chemicals, those big names of chemicals I mentioned, are critical to have normal brain function. And the treatment for those can be something very, very simple.